So Botox continues to be probably the most popular cosmetic treatment in the world today, and is performed by many people, not just by physicians. There's also performed by non-physicians like nurses, anesthetists, nurse practitioners, and even dentists and maybe estheticians. And the reason is Botox is super safe. It's very effective, um, and the good news is that there's really no permanent side effects that can occur from Botox. So in my opinion, that's probably why it's gotten so popular and why so many different people are offering it, because at the end of the day, they know they cannot harm the patient. If you get a bad result, if you don't like the way you look, if you get some complications, at least those effects are not permanent. You'll be back to normal within about 3 to 4 months. Probably one of the most unwanted complication or potential bad effect from Botox is called ptosis, PTOSIS. The P is silent, but that's where the eyelid gets a little bit droopy and weak. And the reason is Botox inadvertently got into a muscle that opens up your eye, the levator palpebrae superioris. And that can cause a very annoying result where your eye looks lazy. And unfortunately, that's something that people can notice right away, and because the eyes are what draws people to your face. And fortunately, it's not very common. It does happen to the best of injectors. No one can say they've never had it. I've had it myself. The company Allergan does report the reported instances is about 3%, so it can occur. So obviously, you want to minimize that or try to avoid it if at all possible. And there are some things that we can do to try to avoid it. So probably the most likely reason you get lazy eye is because that Botox, when it's injected to the corrugators, which are the muscle that makes these angry lines, the corrugator muscle is like this and like that. There's a tail there, and if it's injected either inappropriately or maybe just from bad luck, that Botox diffuses or drifts into that muscle that lifts your eye, and then you can get that lazy eye or droopy eyelid. And that can last anywhere from 2 weeks to, like I said, all the way up to three or 4 months for Botox to completely wear off. It can be very annoying, and obviously no one wants to walk around with 3 months of a lazy eye. There are some things that we can do to try to counteract it and maybe make it look a little bit better while we wait for it to wear off. And one option is to prescribe medical treatment called iodopine, which is a medicine that can stimulate Mueller's muscle and counteract it. It doesn't reverse Botox, but it can stimulate another eyelid muscle to try to help that eyelid lift up more. There's also an over-the-counter antihistamine drop that can be used as well, Navcon A. But there's also some things that we can try to do to minimize. We can never make that risk zero, but we can try to do things to hopefully minimize that risk to as close to zero as possible. Some things to also be aware of is that probably not a great idea. We usually don't advise doing these kind of treatments right before a major event, like a speaking event or maybe a wedding that you have to be part of. Definitely try not to do it the week before. You may want to do it a few weeks before, and hopefully, ideally, you've had a series of these treatments already done with your injector, so that you won't have this, likely won't have this complication. But let's say you get treated, there are patient factors and injector factors that can hopefully minimize you developing this lazy eye. On the patient side, I always recommend my patients to not work out for 24 hours. Two reasons. One is these Botox treatments, even fillers, they're all done with needles. So just by that fact, you can have a real risk of bruising, and that's just unavoidable. But most of our Botox patients don't bleed, maybe tiny little pin pricks here and there. But if you leave the office with no problem, but if you work out, there is a small risk that those little needle entry points can pop and bruise up. So I advise our patients not to work out for about 24 hours. Advice out there, I've heard many people ask me, well, should I not lie down? And I think maybe that's one reason why the thought was if you lie down, as you're lying flatter, that Botox may drift into the eyelid muscle. I don't really stress that to our patients. I've heard other experts who haven't had that and don't give that advice. I know in fellowship we did many of these, hundreds, and we never give them that advice, and we don't see an increased incidence of droopy eye or lazy eye. So I don't particularly put any stock in that, but that's definitely something you can do if you want to maximize your chance of not having this complication. Um, One thing I do advise my patients is don't rub the area too hard, because that is, in my opinion, a real risk that you could push that Botox, help it diffuse into that eyelid muscle that can cause a lazy eye. So wash your face gently, but don't rub it. I've heard some experts say that they've seen in their patients it's sort of a natural tendency to try to rub the area. So try not to do that. I guess jumping up and down like jumping jacks could potentially cause that, but that's why we advise our patients not to work out for 24 hours. Now, on the injector technique side, the most important thing to minimize this risk is understanding the knowledge of the anatomy of the corrugators. The corrugators is a muscle right here, and there's a tail that goes near the end, the tail of the corrugators. And that's usually if it's injected in a position maybe too close to the pupil, that increased the risk, I think. I think looking back at my experience, maybe I did inject too close to the pupil line. But another thing is to also inject it not too deep. So the muscle fans out and goes really close to the skin. So if you inject superficially, that tends to minimize or decrease the risk of the Botox diffusing into the area that you don't want it to. So on the injector side, know your anatomy, injecting properly, and knowing not to inject in a plane of the pupil where the risk is highest and more superficially. Other things to consider if you're injecting Botox here is maybe not injecting the tail of the corrugator, and that will definitely further reduce your risk. Of course, if you don't inject the corrugator, the patient has to understand that there will be, maybe no motion here, but there will be a little bit slight motion there, but that's a compromise. And some patients, and maybe the injector was willing to take that to try to lower that risk of ptosis even more. Now, if you decrease the dose, that could also lessen the chance of ptosis, but then with lower dose, then you also have less effect and maybe it doesn't last as long. And so it's all the trade-off. You want to make sure you get the most benefit while minimizing the risk of complications. In our practice, our typical protocol, 20 units, 10 and 10. Most patients do great. They have a good result. And again, the risk of ptosis is very, very low. So I hope that answers your question about Botox. If you have any questions, just give us a call.